Hello and welcome to The Vaccine. I'm Jeremy Fernandez. Tonight, a stark warning for New South Wales. Thousands will die or be hospitalised if more people aren't vaccinated. And months into the rollout, are enough Indigenous Australians getting easy and quick access to vaccines? But first, new lockdown measures have just been imposed in New South Wales as the COVID outbreak that grips Sydney threatens to worsen. There were 44 cases today, up to 34 of those spent some time in the community while they were infectious. The Premier Gladys Berejiklian says that unless the number of cases dramatically turns around, she can't see restrictions lifting next Friday. Anyone in Greater Sydney, including the Central Coast, Blue Mountains, Wollongong and Shell Harbour, can now only exercise in pairs within 10 kilometres of their homes. Only one person from each household can shop each day for essentials, and funerals will be limited to 10 people from Sunday.
The difference to this strain and other countries responding to this strain are that we have a very low level of vaccination in New South Wales. It's only 9%. We do not have the option of living with this. We have to quash the community transmission, because if we don't, we will see thousands and thousands of people in hospital and lots of people, thousands of people potentially dying.
Scott Morrison is backing the New South Wales Premier's introduction of tougher restrictions aimed at stopping the spread of the virus.
We also agreed today that a national cabinet pilot would be established for home quarantine. That would be done in a lead jurisdiction, and South Australia has indicated their intention to go forward as the host jurisdiction for that home quarantine trial, which would be a 2-week quarantine period based on the advice received from the medical expert panel, and we'll be working with South Australia to put that pilot in place as soon as possible. That will be a transparent project with all the other states and territories. It will be run, of course, by South Australia, but with the active engagement and visibility of all the other states and territories, so they are in a position to pick up that project on the completion of a successful pilot program. I think this is an important development. I think it's trialling out these new quarantine arrangements, which will take significant pressure off if it's successful. Of course, the formal quarantine system. If you're able to make this work, it means in phases, particularly phase 3, but even potentially in phase 2, you have a greater opportunity for Australians who are vaccinated to be able to leave Australia and come back and put no pressure on the hotel quarantine system, and that can see some of these restrictions ease with very low risk.
Casey Briggs joins us now with the latest on the case numbers in New South Wales. Casey?
Hi, Jeremy. Well, virtually every piece of data that we're seeing out of New South Wales at the moment is trending, sadly, in the wrong direction. The 7-day average had actually flattened out for a few days after cases in the east of Sydney subsided, but it's growing again now that we're seeing more and more cases popping up in Western Sydney. We're also seeing, sadly, more cases out in the community while infectious, and the numbers of tests being reported today are coming down as well. From a peak at the beginning of the month to now, what we've seen on Friday is test numbers 40% lower than the previous Friday. We wouldn't be in this situation, of course, if our vaccination rate was a fair bit better than it is. Here's the status of that. About 10% of Australians are now fully vaccinated. 32% of people have had a first dose of a coronavirus vaccine. And that daily vaccination rate is just inching up slowly. Some of the smaller states, well, they've managed to ramp up their vaccination program quite a bit faster than the bigger states. Victoria is not doing too badly. Had a bit of a boost, though, remember, from in the form of extra Pfizer doses from the federal government through their last outbreak. New South Wales is right down near the bottom with Western Australia. The pace of vaccinations in Sydney and New South Wales has actually picked up since the lockdown began. It is still, though, slower per capita than many of the other states. And Pfizer is still clearly a limiting problem, which means that, that is at least improving with the increased supply in Pfizer, being able to bring forward some of those doses earlier than we'd expected. These are the initial dose allocations that the government had published for when we'd expect various vaccines to arrive. This news that we'll get some of the doses from Pfizer early basically means we'll get about 1.5 million or just over doses earlier than we would have expected in August. That's obviously a lot of people. That's a lot of people that can get vaccinated sooner than they otherwise would have. But there are a lot of people needing vaccination, and that's not going to make a gigantic change to the pace at which Australia can move into the next phase of this pandemic and start to think about what life after lockdowns looks like. But it is worth mentioning as well that the number of doses in Australia that's available for use but aren't yet being used, that's actually been growing. Presumably most of these are AstraZeneca doses, and at the last federal government update there were more than 3 million doses sitting available for patients but not yet used. And that, 3.1 million, that's more than enough to fully vaccinate everyone aged over 70 in Australia that hasn't yet been vaccinated. More than a quarter of those haven't had a first dose yet.
Casey, thank you. Well, National Cabinet's met again to discuss the pandemic and what's being done to combat this latest outbreak. Caps on international arrivals and a possible home quarantine pilot program were also on the agenda, along with the vaccine rollout. Sophie Scott is the ABC's medical reporter. Sophie, Scott Morrison is urging people to get their second dose of the AstraZeneca vaccine after 2 months instead of 3 months. What are doctors telling you about whether that's a good idea or not?
Well, I think the advice is a little bit confusing because ATAGI, which is the federal government's advisory body on immunisation, recommends that people wait the full 12 weeks between doses, and that's because that's when it's most effective. There was a big study in the Lancet of about 17,000 people, and it found when you did wait that full 3 months that you got the most effective vaccine, whereas if you dropped down to 6 weeks between the two doses, the effectiveness dropped to about 55%. So it's a significant reduction in effectiveness by dropping down the interval. Having said that, the reason that Scott Morrison said that people should have it sooner in those areas where there's community transmission is for that reason, because it's safer for people to get a vaccine and the second dose in areas where there's a lot of transmission rather than waiting. And that's why countries like the UK have shortened the interval as well. So it's really not a blanket recommendation that everyone go out and get it sooner. The recommendation is what ATAGI says, to wait the 12 weeks, except if you're in those areas where there's a lot of community transmission, the Prime Minister was suggesting it might be better to get it sooner rather than later. But it has created a little bit of confusion. There's been people wanting to get the vaccine earlier than the 12 weeks, and doctors have said, no, they'd rather wait the full 12 weeks. So it really depends on where you live, I think. That's the answer to that question.
We're also seeing some momentum picking up around this discussion about whether children should be vaccinated. What's the latest on that plan here in Australia?
Well, we know, as we're all learning more about these variants, that the Delta variant is so much more transmissible. And what we're seeing in countries like the UK, where they've vaccinated a lot of the population, but they haven't vaccinated young children. And so a lot of kids are getting the COVID variant, the Delta variant of COVID in the UK. And we're seeing that in Australia as well. And so at the moment, countries like the UK and the US and Canada are vaccinating children and teenagers from about 12 upwards. In Australia, the only vaccines that are available are from 16 and up, but there is a proposal in front of the TGA for the Pfizer vaccine for people 12 to 15. And so that's something under consideration at the moment. And most of the experts we've spoken to think that that probably will be approved and sort of sooner rather than later. Because what happens if you don't vaccinate children, it's a very vulnerable group, and then you're also putting teachers at risk as well, because we know now when the pandemic first started, we didn't really know what the impact on kids in COVID was. We thought they didn't get it or they couldn't spread it. We now know that's not the case. They can get it, they can get very sick from it, and they can also pass it on. So that puts teachers at risk. So I think the experts we're speaking to have said that really vaccinating children has to be part of the solution. And as I've said, the proposal is on the table to vaccinate kids 12 to 15. So that's the next cohort we'll be looking at. It's still a fair way off vaccinating younger children. Those studies are still being done in the US. And so we need to see what that data says before it could be even looked at for use here in Australia.
Sophie Scott, thank you. Well, this latest outbreak has added some considerable urgency to the vaccination drive, even for people living outside New South Wales. Indigenous Australians were given early priority in this pandemic. 100,000 First Nations people have now received at least one dose. That's about 14% of the Indigenous population. Dr. Lorraine Anderson is a GP and the Medical Director of the Kimberley Aboriginal Medical Services. She joins us now. Dr. Anderson, thank you for joining us. There's been a lot of public policy shaped around protecting First Nations people, particularly in remote communities. What's your assessment of how this vaccination drive is going for First Nations people?
Look, I think it's going really well, Jeremy. We've got some really good traction in terms of access to vaccine through the Commonwealth with our excellent assistance of NACCHO, so our National Aboriginal Community Controlled Health Organisation. So good access, good numbers of vaccines out there, some really good people on the ground getting the word out that vaccination is really important. It's good to hear that we're getting good numbers across the country, and certainly here in the Kimberley, which is in the top northwest area of WA. We're actually across our sector looking at probably sitting around 15% of people have been vaccinated so far. We're a long way off being finished, but we're getting there.
Is 15% a good number? I mean, we're talking about much greater numbers needing to be vaccinated, particularly in vulnerable communities, before we can consider this idea of herd immunity and what that means for open borders.
We're looking for 95% of our remote population being vaccinated. So, as I say, we've got a long way to go, but we're getting good traction now. The numbers are improving every day. Unfortunately, we do have a little bit of hesitancy, a little bit of complacency. We've kept COVID out of the Kimberley for the most part, and certainly out of WA for the most part as well. And so it's very hard to make people understand the need to be vaccinated, given that they haven't actually had very close contact with COVID up until now.
So how do you communicate that level of urgency and talk around the hesitancy in circumstances where perhaps in northwestern WA it's not as urgent as it is in Sydney right now?
Yeah, that's exactly right. And, the conversation that we're having is around the importance of being vaccinated before it becomes urgent. So we all know that, the vaccination takes time to be effective and to develop that immunity. And so trying to have that conversation and, yarning with people out in the community about how important it is for us to be prepared for COVID and not wait until it gets here before we jump to attention.
We're seeing this issue around the country right now, most notably in southwestern Sydney, where information and data is not necessarily reaching everyone, particularly those who don't consume social media or mainstream media broadcasts like ours. And that's being partly blamed for the surge in Sydney. What's your sense about the best way to reach those people who don't necessarily get their information from traditional sources?
Yeah, so what we've done up here is we've actually had a vaccine group, and that's a group of people with very good clinical as well as communication skills, and they've actually gone around our remote communities and spent a lot of time talking to community, and in particular answering questions and dispelling the myths, and in a very non-judgmental way, just getting that conversation out there and getting people to understand why it's so important, in particular, to be vaccinated.
Are you concerned about Delta reaching WA, which has been largely insulated from any strain of coronavirus up to this point?
We're very concerned about Delta. Delta is, from what we're hearing, is more transmissible. And our big concern, in particular for our remote communities, is not only having COVID get into our communities, but we know that people need to come out of our communities to access services in the larger towns in the Kimberley, and those towns are currently being frequented by large numbers of tourists. So the chances of us getting the Delta variant into the Kimberley is reasonably high, and the chances of our remote community members coming in touch with that is reasonably high as well. We're very concerned about it.
How long will it take before the vaccination numbers are at a place where you're happy with them?
That's the million-dollar question. We're looking for 95%. We know that we're aiming extremely high with that, but we're going to keep trying to reach that percentage.
Dr. Lorraine Anderson, it's terrific to have you on the program. Thank you so much.
Thanks very much.
And that is the show for this week. Don't forget you can join us every Friday at this time and any time on ABC iView. From all of us, stay safe. Bye for now.